Hi, I'm Dr. Roger Smith and I'm an upper cervical chiropractor in Huntington Beach, California. Today we're going to talk about spinal curves, specifically the upper neck curve. I'm going to show you what we look for in terms of curvature of the spine and things that we are distributed in a normal or demonstrated in a normal neck curve. This is an x-ray of a patient with a pretty normal neck curve. Now we say normal, and that's a term that it needs to be explained because there really is no normal. Normal is whatever your body is doing at that point in time. But there's some textbook measurements that they've taken of spinal curvatures, and they found that a 20 to 30 degree curve when measured from the second bone to the sixth bone, and you measure that angle drawing perpendicular parallel lines to those bones, and measuring that angle, a 20 to 30 degree curve is considered normal. So this patient has a 31 degree curve, which is just right above the normal range, but that's okay. We also look at the spacing between the bones. That's the black space here between the bones. That is the intervertebral disc. That is actually the shock absorber of the spine. Then we look at the shape of the bone. We want to make sure it's nice and squared off with no lipping or spurring. That's what we call osteophyte formation. So this is a pretty textbook normal neck curve. Good curvature, good bone structure, and good disc spacing. Now I'm going to show you the opposite of that and a spine that is not in the optimum condition. Here we have an illustration of, again, a near normal neck curve. We have a spine that's out of alignment. What we see is many times we'll get a misalignment here in the upper neck. It'll change the posture of the spine. What it does, it takes the weight of the head up here, which should be back on these joints. These are designed to hold the weight of our head. When we get a misalignment in the spine, it shifts the weight of the head forward onto the discs. Well, these discs aren't designed to hold weight. They're really designed to be shock absorbers for the spine. They should have pressure and then be released. But when it's on there for an extended period of time, we'll actually see narrowing of the disc space. And we see the beginnings of osteophyte formation. That's the lipping or spurring that we see here. If this is left uncorrected, it will progress on to where the bones start to fuse together. The body tries to stabilize what's going on, and it will actually end up completely fusing the spine if left uncorrected. So what we want to do is we want to take a look at the spine and find the problem and get it corrected before it progresses into a condition that may be permanent and is not repairable. So for more information on this, go to my website at www.rogersmithdc.com. Your health starts here.